Hello friends, this is Scrumbledore's Army, that's our team name, and our project is Project 49, the Tobacco Tracker, and this is Deliverable 1 for that. Okay, here's our presentation link, which hopefully, since you're watching this, you already have access to. Let's meet the team. So my name is Michael Marachka, I'm the PM and the QA and dev on this team. We've got 4 QAs, and all of us are also developers as well. Between us, we have lots of healthcare experience. We have 2 experienced members on the team, and everyone's fairly familiar with all of the technologies we will be working with moving forward. Okay, so let's talk a little bit about the project overview. So what is the tobacco tracker? Well, it's exactly what it sounds like. The idea is to be able to make people more aware of the amount of tobacco and the amount of carbon monoxide and the amount of tar that's getting put into their systems throughout the course of their lives, and the health risks associated with that. Everyone knows that smoking is bad, but we're hoping to bring awareness by giving customized feedback of what an individual person's unique risks are. So what's the solution? A mobile application which tracks the content of tobacco a person's taking in. Well, let's dive into that a little bit more. First, we got to understand the problem. So what are the high level of problems with cigarettes? Well, we're all sort of familiar with the high level problems. Smoking kills more Americans than alcohol, car accidents, HIV, guns, etc. On top of it being a leading cause of cancer, it can damage almost every organ in the body. And smokers know that cigarettes are bad, but it's sort of a generalized problem. What we want to do is make it customized and say to each individual user, look at the amount of tar and the amount of nicotine and the amount of carbon monoxide being put into your body, and here are the actual dangers associated with the levels you are currently consuming. So, project objective. As written in our project page, the project objective is to scan the barcode of a cigarette box and collect the content of tar, nicotine, and carbon monoxide, and enter the number of cigarettes consumed in total. That's equivalent to those. The application should prompt the health risks at current values of tar, nicotine, and carbon monoxide for that individual. So it's a customized solution. So we need to kind of understand the market. Currently, if we look at cigarette use between youth and adults, it's very, very similar. On the left-hand side, you'll see the use for youth, and the darker red means the larger percentage people are smoking. And on the right-hand side, you'll see the same for adults. The darker blue means the higher percentage of smokers. So smoking is rampant throughout the country, and this is just within the United States. The sooner the person quits smoking, the better for the individual and the health plan and the employer overall. So we're all very well understanding of the market, but it's good to just kind of review the statistics to see that this is still a relevant problem. So what's the business case? Well, we talk a lot about the health and financial benefits. If we can get people to quit smoking earlier, it has a massive ripple effect. It stops secondhand smoke, and it stops lots of other types of problems, respiratory infections, emphysema, miscarriages, etc. So the solution we have is to be able to have a barcode, scan the barcode from a phone, and be able to get a unique count of the cigarettes consumed total, maybe keep a total count of all of their lifetime cigarettes and the amount of negative effect it has had so far on their body. The final thing about this is to talk about our timeline for the project, which is our Gantt chart. So the Gantt chart essentially just breaks down at a high level what each week will have high level planned. So there's everything from the architecture to design to UI, UX, setting up the front end, and then doing actual development and testing, as well as even taking into account the fact that we need to document the entire project. So that goes from week 7, which starts tomorrow, and then goes all the way to week 14, which is the second to last week of the class. These are the resources we've used in this project, and thank you so much for your time.